Hello, my name is Lisa Rong, and I'm an assistant professor in the Department of Anesthesiology. Today, I am happy to be able to share with you one of the projects that I'm doing with the FAIR Mentored Training Research Grant on ischemic mitral regurgitation. So mitral regurgitation is a disease that affects millions of Americans, and it's difficult to treat. Two of the most common interventions for this procedure, if medical therapy fails, is shown on the left and right. On the left, you can see that there is a clip placed between the anterior and posterior leaflets of the mitral valve, bringing the two leaflets closer together and forming better coaptation to decrease the amount of mitral regurgitation that results. On the right, you can see there is a surgical annuloplasty placed around the annulus of the mitral valve, and it cinches the valve together to again decrease that central mitral regurgitation caused by ischemia. So this is just a video showing the type of patients that we want to recruit. Patients with normal leaflet anatomy shown here, but with significant mitral regurgitation that occurs centrally in the valve, as you can see here. In terms of the mitral clip procedure, this is the mitral clip that can be placed between the anterior and posterior leaflets, and it will hopefully decrease the amount of mitral regurgitation over time. So the hypothesis here is that ischemic mitral regurgitation after mitral valve repair will be predicted by advanced imaging techniques of the left ventricle, and change in mitral regurgitation due to general anesthesia will correlate to outcomes, meaning the amount of recurrent mitral regurgitation that will be seen after the index procedure. In terms of background, we will be using strain, which is a new measure of function and physiology of the left ventricle and has been shown to be prognostically significant independent of the left ventricular ejection fraction. This is an example of how to calculate strain from intraoperative TE, and it's an index of displacement looking at how the speckles of myocardium change between systole and diastole. So for our first aim, we'd like to validate left ventricular strain as an index of mitral apparatus infarct burden, and we will be comparing a preoperative cardiac MRI, as shown here in the two images on the left, with regional and global left ventricular strain, as shown by the bullseye plot on the right. Here we look at this enhancement shown by the blue arrow, and we want to compare that to our intraoperative echo findings. In terms of aim 2, we'd like to test the ventricular strain as a predictor of mitral regurgitation. And in aim 3, we'd like to look at the mitral regurgitation response to general anesthesia. Oftentimes after general anesthesia, there are favorable hemodynamic conditions, which causes the amount of central mitral regurgitation visualized to decrease. We would like to see in those patients whether or not a mitral clip or a surgical intervention is more favorable and results in less of a failure rate. In terms of the study update, I started the study January 2019, paused for a couple of months during the peak of the COVID pandemic, and continued recruiting in June of 2020. Our sample size was calculated for a total of 48 patients, 24 mitral clip, and 24 surgical repairs. The main issue that we're having with recruitment is that it's difficult to isolate patients with isolated functional MR or ischemic MR, because there's a lot of patients with mixed disease and a lot of patients with degenerative MR, which is a defect in the leaflet and not a defect in the left ventricle. We are also having some issues recruiting patients with to consent to the cardiac MRI because it results in an additional visit to the hospital from the patients. So as of 8/28, we have enrolled 89 patients trying to cast a broad net, but out of those, only 27 are ischemic MR patients. Our follow-up is pretty robust so far, with an intraoperative TE of 35 patients and a follow-up of 35 patients as well. So thank you very much for your time and for listening, and I appreciate any comments or suggestions as to how to proceed from here. Thank you.